Hi, my name is Barsigian, and I will be presenting on hepatitis A, B, and C. Hepatitis is defined as the inflammation of the liver in response to a viral infection, overconsumption of alcohol, exposure to chemicals, and more. There are actually 5 hepatitis viruses in total, but this presentation will be focusing on A, B, and C, which are the most common hepatitis viruses. So very quickly, I just wanted to go over the liver and its functions within the body. So the liver is located in the upper right hand portion of the abdomen, beneath the diaphragm and above the stomach. The liver regulates most chemical levels within the body and excretes bile. The bile is used to carry waste products away from our liver and eventually be secreted out of the body through urine. The liver also regulates the production of cholesterol, and it converts glucose into glycogen, as well as regulates amino acids in the blood and much more. Hepatitis A dates back to the 17th century when it was actually referred to as epidemic jaundice. Hepatitis A is caused by the hepatitis A virus, commonly referred to as HAV. The hepatitis A virus is a heptovirus, and it is a positive single-stranded RNA virus. Hepatitis A is a short-term, highly contagious disease that is more commonly found in elderly people and is found in the stool and blood of the infected individual. Hepatitis A can be spread when someone ingests the virus by eating contaminated food or drink, as well as person-to-person contact such as oral and anal sex, caring for the sick, and drug use. The rate of infection of hepatitis A is very strongly correlated with the access to safe food and drinking water. And as you can see in this photo, high-income regions have very low levels of hepatitis A, while the low-income areas have very high levels. In fact, the low-income areas, more than 90% of the population is affected with hepatitis A, while high-income areas, less than 50% of the population is affected with hepatitis A. Symptoms of hepatitis A include, but are not limited to, yellow skin or eyes, which is commonly known as jaundice, nausea and vomiting, joint pain, fever, dark urine, diarrhea, and fatigue. Not everyone will develop symptoms of hepatitis A, which is one of the reasons why it is so easily spread, as people don't realize that they actually have hepatitis A. Hepatitis A has an incubation period of approximately 28 days, and if symptoms do appear, they will last for less than 2 months. Diagnosing hepatitis A was a little tricky up until about the 1940s, as it was not differentiated from hepatitis B until then. And the main reason that it was differentiated was because the two viruses have different incubation periods, as hepatitis B has a longer incubation period than hepatitis A. In order to diagnose for hepatitis A, you will need a blood test, which is referred to as the HAV specific immunoglobulin antibodies test. Treatment and prevention of hepatitis A. There is no specific treatment for hepatitis A. However, rest, proper nutrition, and an increase in fluids is always recommended. Prevention is the best way to stop the spread of hepatitis A. The best way to prevent yourself from getting hepatitis A is through vaccination. The vaccine is a series of 2 to 3 shots, and it is an inactivated hepatitis A virus, commonly known as Havrix. In 1996, it became a routine childhood vaccine in the United States. Between 1996 and 2007, when routine vaccination became more popular, there was a 92% decline in reported cases of hepatitis A within children in the United States. Another way to prevent yourself from hepatitis A is through proper hand hygiene. This, I couldn't help but think about the Typhoid Mary video that we watched in class, as Mary spread typhoid fever throughout all of New York City due to not washing her hands well enough. And it just kind of is another example that goes to show how proper hand hygiene is very important, and it really can cut back on the spread of disease if people are properly washing their hands and taking the right measures. Okay, moving on to hepatitis B. Hepatitis B was discovered in 1976 by Dr. Blumberg. Hepatitis B is caused by the hepatitis B virus, commonly referred to as HBV. HBV is a double-stranded DNA virus that replicates through reverse transcription. Hepatitis B can be either a short-term infection or a chronic infection. If it is chronic, it can lead to cirrhosis or scarring, as well as liver cancer. Hepatitis B is spread when blood, semen, or other bodily fluids of an infected person enter the body of an individual who is not infected. This can be done through sex, the sharing of needles, or from mother to baby at birth. Approximately 1/3 of the world's population has been infected with hepatitis B. As you can see in this image, hepatitis B is most prevalent in the Western Pacific region and West Africa, with 6.2% of the population being infected. I think it is important to note the comparison between Africa and the Americas, as America has less than 0.7% of the population is infected with hepatitis B. Symptoms of hepatitis B include, but are not limited to, fatigue, poor appetite, stomach pain, nausea, and jaundice. Just like hepatitis A, not everyone will develop symptoms. However, if they do, they will occur about 90 days to 3 months after exposure, as hepatitis B has quite a long incubation period. In serious chronic infections, liver failure is possible, and therefore patients with serious infections will show signs and symptoms of liver failure on top of these symptoms listed here. Diagnosing hepatitis B is done through a series of blood tests that are referred to as the hepatitis B panel. The first test that is commonly done is called the hepatitis B surface antigen, or HBsAg test. This test detects the presence of the hepatitis B virus surface antigen within the blood. If an individual tests positive, more tests need to be done to see if they have a chronic or an acute infection. An acute hepatitis B infection is characterized by the presence of HBsAg and immunoglobulin M, or IgM. A chronic infection is characterized of the presence of HBsAg and IgM for over 6 months. The next test that is commonly used is the hepatitis B surface antibody, or anti-HBs test. This test indicates if an individual has antibodies or not. This will let providers know whether or not a patient is protected against hepatitis B. The third test that is commonly done is the hepatitis B core antibody, or anti-HBC test. This test indicates whether or not there was a past or present infection. It is important to note that a core antibody provides no protection against the virus, but only indicates whether or not there has been or there currently is an infection within the body. So, as I mentioned earlier, hepatitis B can spread from mother to baby during birth, and I just wanted to note on this as I found it to be very interesting, and I hope that you guys think it is too. So, babies born from a mother with hepatitis B have more than a 90% risk of developing chronic hepatitis B if they're not properly treated. So, it is recommended that all pregnant women be tested for hepatitis B. Ideally, they will do this as soon as possible within the first trimester. If the woman tests positive for hepatitis B, a doctor should typically require a hepatitis B viral load blood test or HBV DNA. If the viral load is very high, it's not uncommon for the provider to prescribe the woman an oral antiviral drug during the third trimester to reduce the infection at birth. When it is time to deliver the baby, proper medications and precautions need to be put in place during delivery. After the baby is born, there's a series of 2 vaccines that are given to the child. Typically, these are given as quickly as possible. However, it can be between 12 to 24 hours after birth, but it is recommended to do it immediately, as if you wait, you're more likely to forget or make a mistake or something like that. So the first dose is commonly called the birth dose of hepatitis B, and it's just the same hepatitis B vaccine that is commonly given to children within their first few months of life. And the second dose is a hepatitis B immunoglobulin dose. It's HGIB. And unfortunately, it is given in the United States. However, the World Health Organization does not recommend this, only the CDC does. So the second vaccine is not always available in all countries. So it's important to keep in mind that depending on the country, the child may only be able to get the first dose of the Hep B vaccine, which I thought was just... Treatment and prevention of hepatitis B. There is currently no cure for acute hepatitis B. However, adequate rest, fluid intake, and a healthy diet is always recommended. Along with this, it is important to note and inform patients that they must avoid medications such as Tylenol and acetaminophen to protect their liver as it already is in a weakened state. Chronic hepatitis B can be treated but not cured with antiviral medications or, in severe cases, liver transplant. Medications include but are not limited to tenofovir disoproxil, tenofovir alafenamide, and entecavir, and more. I'm so sorry if I did not pronounce those right. Prevention through vaccination is the best way to slow the spread of hepatitis B. The hepatitis B vaccine was created in 1969 by Dr. Bloomberg, and if you remember, he is actually the same man who discovered hepatitis B, so it's kind of cool that he not only discovered it, but also created a vaccine for it. I just thought that was a little cool. The vaccine is usually a series of 2 to 4 doses, same as the hepatitis A vaccination. It really just depends on the manufacturer of the vaccine and what your provider thinks is best for you. Okay, moving on to hepatitis C. Hepatitis C is caused by the hepatitis C virus, or HCV. Hepatitis C virus is a single-stranded RNA virus that can be short-term or chronic. If it is chronic, it can result in cirrhosis or scarring and even liver cancer. Hepatitis C is spread through contact with blood from an infected individual. It is most commonly spread through the sharing of needles. It is estimated that 71 million people globally have chronic hepatitis C and is one of the leading causes of death globally. So, symptoms of hepatitis C are a little tricky as 70 to 80% of individuals infected with hepatitis C actually do not show any symptoms at all. If symptoms do appear, though, they are often a sign of advanced liver disease. So, some signs and symptoms of advanced liver disease include, but are not limited to, jaundice, abdominal pain and swelling, dry, itchy skin, fatigue, nausea and vomiting, and more. Diagnosing hepatitis C can be done through several blood tests that detect infection. The most common test is called an HCV antibody test. This test tells whether or not an individual is non-reactive or reactive to the HCV antibody. If the results come back reactive or positive, additional tests need to be done to see if the patient is currently infected. These additional tests are called a nucleic acid test, or NAT, for HCV RNA. Another name for this test is simply PCR. If this test comes back negative, it indicates that the patient was infected with the hepatitis C virus, but it is no longer in the body as they have been cured or the virus was cleared naturally. If the result is positive, it means that the patient is currently infected with the virus and treatment needs to be discussed with their provider. I think that it's important to note that hepatitis B can be detected as early as 1 to 2 weeks after exposure, despite the fact that hepatitis C has a 8 to 11 week incubation period. I find that to be very interesting that it can still be detected, even though no signs or symptoms are being shown yet. It is recommended that those at higher risk of contracting hepatitis C get tested frequently. So individuals who may be sharing needles, such as drug users or people who work in hospitals and are administering vaccines or taking blood, need to be careful with their needles and make sure that they're getting tested frequently for hepatitis C. Treatment and prevention of hepatitis C. Treatment is not always necessary as the body can fight off an acute infection. However, if it is chronic, then a pan-genotypic direct-acting antiviral, or DAAS, is given to the individual for 12 to 24 weeks. In May of 2011, the FDA first approved DAAS in combination with pegylated interferon A and ribavirin. When combining these drugs, it increases the rate of how quickly the patient will improve. However, in 2013, a second generation DAA became the main treatment with a 90% success rate. In 2014, the FDA approved DAAs as the number one route of treatment for hepatitis C. There is currently no effective vaccine to prevent hepatitis C. However, the best way to prevent yourself from hepatitis C is through the safe handling and disposal of needles, as well as routine testing, especially for individuals who are higher risk. So, as I was researching hepatitis, I came across multiple articles that covered the comorbidity of HIV and hepatitis, and I think that it's something that's really important to know on as the comorbidity rates between the two are so high. So, very quickly, HIV or human immunodeficiency virus is a retrovirus that attacks the body's immune system. HIV is transmitted through direct contact with an individual's bodily fluids such as blood, semen, and vaginal fluids. And if you can recall, hepatitis B and C are both blood-borne illnesses that are transmitted primarily through sexual contact and injection. So they're transmitted the same way. So as you could imagine, the comorbidity rates are going to be pretty high. In 2009, approximately 21% of adults with HIV tested positive for HCV or hepatitis C. Currently, the co-infection rate of more specifically injection drug users with HIV is 62 to 80% co-infected. And as you can see in this photo, 1 in 10 people with HIV have hepatitis B, and 1 in 5 individuals living with HIV also have hepatitis C. And I just thought that these numbers were much larger than I expected, and so I thought that it was very interesting and wanted to add it into my presentation. Currently, as of 2020, all individuals with HIV are to be tested for hepatitis A, B, and C, and they must receive the hepatitis A and B vaccine if they have not already. And if they have, it is commonly recommended that they will receive a booster. And due to the fact that there is no vaccine for hepatitis C, people who are higher risk must be getting routine testing for hepatitis C. So this is just a nice illustration that I think really wraps everything up, and it's just a comparison of hepatitis A, B, and C, and it really just encompasses everything that I have said throughout this entire presentation in just one little picture, and I think that it's kind of neat. So just to review, hepatitis A is most commonly spread through feces, and there is a vaccine for hepatitis A. Hepatitis B is commonly spread through blood, semen, and vaginal fluid, and there's also a vaccine for hepatitis B as well. Hepatitis C is spread through the blood, most commonly through the sharing of needles, and unfortunately, there is no vaccine for hepatitis C at this time. However, scientists are working tirelessly to hopefully develop a vaccine for hepatitis C. So I guess with that, that is the end of my presentation, and here are my references. I hope you enjoyed my presentation and you learned something new today.